Good day, good people. Today we are focusing on drugs used in radiography. So, on today's episode, we're talking about surgical spirit. Surgical spirit is a clear solution and it comes in clear PET bottles with plastic caps. So, surgical spirit is a mixture of ethanol, methanol, and other substances. It contains methyl salicylate 0.5% V over V as the active ingredient. Surgical spirit also contains diethyl phthalate BP, castor oil, and industrial methylated spirit BP. So moving on to the mechanism of action of surgical spirit. Surgical spirit works to tighten, harden, and sanitize the skin's epidermis. We have methyl salicylate as the active ingredient. It causes dilation of the skin's vessels and is absorbed through the skin, hence making it harder. It is used to prepare the skin before injection. Surgical spirit can also be used as a cleansing agent on the skin's surface and also has antibacterial qualities. Action of the antiseptics is due to the mutual reaction with the cell surface of the microorganisms, followed by their penetration into the cells and their influence on the certain target area. Now we are talking about pharmacology of surgical spirit. Under pharmacology, we have pharmacokinetic properties. Pharmacokinetics is described as what the body does to a drug. It also refers to the movement of drug into, through, and out of the body. So, methyl salicylate may be absorbed through intact skin after excessive topical application. Frequent use may produce irritation and dry skin. Moving on to pharmacodynamic properties. Pharmacodynamics is defined as the response of the body to the drug. Methyl salicylate has the action of salicylates causing dilation of skin vessels. Next, we have the routes of administration. So, you apply to the affected area using cotton wool as required. It is for external use only. You wet a swab of cotton wool with surgical spirit and apply to the skin. The product is suitable for use by adults, children, and the elderly. It is to be used as required. With me here, I have the special warnings and precautions for use. Number 1, do not apply to scratched or broken skin. Remember, it is for external use only. Number 2, keep out of the sight and reach of children. Number 3, do not apply to mucous membranes. These are membranes such as the linings of the mouth and the nose. Number 4, caution. This preparation is flammable. Keep away from naked flames, harmful by inhalation. Next, it may cause burning sensation on damaged skin. So here are the common uses of surgical spirit. It is for the treatment and prevention of bed sores in patients who are bedridden. It can also be used for treatment on minor cuts and abrasions where it acts as a disinfectant, leaving the skin bacteria-free. Next, it can be used to clean and disinfect skin prior to surgery or before giving injections. Next, the addition of a little surgical spirit in a bed bath acts as a mild and cooling assuagement for the skin. It can also be used to control germs and bacteria around the home. Last but not least, we have the relevance of surgical spirit in radiography. So as we all know, there is a prevalence of bacterial contamination on ultrasound probes, cords, keyboards, X-ray equipment, cassettes, and radiographic markers. So it is highly recommended to sterilize and disinfect them before a patient comes in. So it can be used to clean hard surfaces before radiography procedures. It can also be used to disinfect equipment used in radiography rooms, the ones that I've mentioned before. Surgical spirit can be used to clean and disinfect skin before inserting cannulas and CT injectors. We all know that some patients may come from the wards with their cannulas or drips in. So just in case they fall off, you have to have surgical spirit so that you can, like I mentioned before, you rub it on the skin before inserting injections. So we have what is called interventional radiology. So this is a subspecialty that uses imaging technologies to guide and assist invasive procedures. So to guide the required level of decontamination in interventional radiology, we need surgical spirit because the incision site have to be kept sterile. So this is all I had for you. I hope you have understood. Thank you for your time.